Hi, Lucy. You're muted.
Lucy is going to pantomime her participation.
No, it just kept muting me.
Well, that's probably Christina. She's sitting there and she's doing that on purpose.
Yeah, I will be muting it when if Tom is pounding with the saw down, the nails downstairs in the basement, I will be muting it.
Yeah, I will too if Steve starts sawing with the saw downstairs.
No, he's been sawing, putting flooring in down in the basement of the cabin.
Oh, sounds like you've got a project going.
Oh yeah, also have a lot of heat going.
Well, yes, it is. It is warm.
And we don't have air conditioning here.
That's okay, neither does the health department.
We live with fans.
Yes.
The last notice from the health department, Christina, sounded like it was coming.
Yeah.
You're waiting for the helicopter to come over it or a crane to come over the roof.
Yeah, that ought to be quite the project though.
This evening is supposed to be on by 6 o'clock. In the meantime, I've got a fan behind me and the lights are out.
I can see that. I knew why.
Just for you, I've got a fan going too.
Okay.
Yeah, it's a little warm.
I don't recall this early up north being this warm for so many days though.
You know, I think it has changed over the years. Even way up at the place my sister has up near, it's, you know, just way up near Lake Superior.
Okay, yeah, well, we're like 2 miles south of the UP, so we're.
Yeah. And she liked, after she retired, she liked to spend quite a bit of time up there in the summer. She finally put air conditioning in.
Yeah.
She just was not having a good time many of the days.
I don't know if this means that by August it's going to be 45 degrees or not. Well, like they say, if you don't like the weather up north, wait 5 minutes, it's bound to change.
I know it. Have you guys had rain up there, or is it also so dry?
It's dry. We haven't had any rain.
Okay, that's rugged too. Always worry about fire danger then.
Yeah.
Mhm. Who else are we expecting? Do you know?
Let's see. Dr. Halverson, Bob McGreeth.
Okay.
So we have a quorum. Barely.
Yeah. Quorums are usually barely, aren't they?
Yeah, exactly.
Hi, Bob.
Hey, Bob.
There he is.
Hey. How are you? I was on the 4:30.
Oh. Then suddenly you looked and went, 3:30.
It was pretty quiet on the 4:30.
Yeah.
Okay, so now Pat, you're the host. Oops. Yeah.
I am?
Yeah,
It
what
just
is
said
it?
Pat, you're the host. Yeah.
Yeah,
Oh,
something happened to Christina.
okay.
Well, I don't know if it's because we're going to be talking about the administrator's review, if she did that because of that.
But maybe, but did you, well, as long as everybody's got their papers with them,
Yeah.
because I don't have mine up on the computer. I have them on my iPad, so I'm not like ready to do screen sharing to talk about this. But
Okay.
if everybody's got them, then it doesn't matter which of us is the host, right?
Right.
Right. Is Sandra coming?
Did you talk to her, Lucy?
No.
Well, we got this one thing that has to do with,
The COVID.
yeah, so I mean,
They've got her down for it, so I would assume she's coming.
Okay, well,
Aren't we talking about her?
let's give it 5 minutes.
Okay.
yeah,
Aren't we talking about her compensation as well?
Well,
we're talking about review.
we're just talking about how we're going to do the review, and then we'll have that conversation, Bob.
Okay.
But I didn't think that wasn't where you wanted to go today, was it, Lucy?
No, but this is just like, let's get thinking about this, and this is what we have, and
Okay.
It's so long. It feels like a vastly long time since we did this stuff. I know it isn't, but the world it's just been, I don't know, life or something that feels like such a long time.
Does.
Yes, it does.
now, are they looking at July at going to in-person meetings?
We're looking at it for next week.
Oh, for next, okay, I won't be here for that. I won't be back for that.
Yeah, because I thought Sandra said June was going to be in person.
I couldn't remember if she said June or July.
Oh, I don't know then.
I probably won't be here for July either.
Okay.
And I don't know about August yet. We're what we call sunbirds. We're not snowbirds.
You come home in the winter?
Yeah.
Hey, a change of scenery is kind of nice.
It's a slower pace up here, that's for sure.
Mhm.
What's your background there, Ron?
In honor of the health department not having air conditioning, I turned the fan on.
I do appreciate the humor there.
That is.
I
Very
just, really, Sandra has been on the hot seat for so long, and now she's literally on the hot seat.
Yeah, I fear that's true. I'm just wondering, Ron, if you actually have a little too much time on your hands, and you have
Yes, I do.
you've mastered this whole Zoom background thing so well.
Yes,
It
he has.
makes me.
I'd have a green background if I didn't know it cost $100. So that ain't worth it for me. That would make
Okay.
it come up better, but yeah.
Katie, do you need to say something?
Sorry, yes, I do. I'm sorry.
just wondering, Ron,
Sorry to interrupt.
if you actually have a little-
We're kind of having a slight technical issue on this side with Christina's computer, so we're kind of rebooting, and I have you guys back on live.
Yeah.
And sorry, that is it is not on mute. Okay, so I fixed that. So now you don't have the double background noise going on. Looks like we've got you and you're still live, and we're able to transfer you over to my computer. So you can proceed with your meeting because we see everything is going okay and you are live, and we might try to switch you back soon. So, okay,
Do
thanks.
you know if Sandra is joining us?
That's a good question. Let me find out for you.
Thank you.
Okay.
Or is she melted away?
We will not go to any Wicked Witch of the West kind of story.
No.
Hey, calm down. I've got it. It's going on.
I know it's being recorded, so that's a good thing.
Okay, yes, Dr. Martell is going to be joining us shortly,
Okay.
and then we'll get you back up too on the other. So.
Yeah.
Is Rockford supposed to be getting some rain tonight, or?
You know, I don't think so. We get,
They've been promising it and it never comes.
I know, we get some clouds. Steve was at a meeting that was in person yesterday for the first time, and where he was, there was a little shower. I was sitting here the whole time. There was nothing. It's been really pop up like that.
My phone just literally changed as I was looking at it. It showed that we were going to hit some rain, a chance of rain between 4 and 6, and it just went away.
Yeah,
Every day it says we're going to get a chance of rain, and it goes away.
I think it's really sporadic and not much chance. And
Yeah.
I've been doing watering because might as well.
Well, there's supposed to be a change in the weather on Saturday. A cold front's supposed to come in, and then there's potential choice or a chance of a rain shower.
Okay. Hi, Sandra.
Hello, Sandra.
Hi, Sandra.
I know it's,
I turned the fan on for you.
it's a little warm, but the crane just left, so that's a good sign.
Good.
But it's, as you would guess, it's always interesting. Never a dull moment.
Yep.
I'll let them know that we are on live streaming. It is live streaming. Sorry.
Hi, Christina.
There's a little panic here, but I said it's recording and it's live stream, so we should be good.
Okay.
I see. Oh, Ron, you do have a good fan picture going up.
Yeah, I think that's Todd getting all the air though.
Yeah.
Yeah, that's from you, Pat.
And do you have a landline still?
No. Oh, the
Interesting.
hearing aids.
That didn't do it the last time though, did it?
Well,
I think it did.
She did an experiment. We had her take them out. I mean,
Yeah, it worked.
Is it better?
I don't hear anything now.
yes.
You probably
You know,
don't either.
it's weird because it's only on this meeting that I've had trouble with that. I have some other meetings. Nobody has ever mentioned the issue, and it never happened. And I use this little computer for a lot of them, although I also use my iPad for the family things, and it never
Yeah.
happens there.
You wonder, maybe it's the record. I don't know. It's maybe the Zoom connection. I don't know.
There's something about the hearing aids and the Bluetooth, I think.
Yeah,
It doesn't matter. I just forgot to take them out. And so,
If you guys want to proceed with the meeting, that's fine. I can catch up.
okay.
it is
Catch up.
recording, Christina, and it's on live stream, so we're good.
And
Okay.
then, Lucy, you can go ahead.
Okay, we can start the meeting. It's 3:39. And the first thing is the approval of the agenda.
I
Is
move
there a motion
approval.
to? There's a second? Okay, all in favor?
Aye.
All right, I don't see anybody opposed. The next item is the COVID-19 mitigation. And Dr. Martell, we'll let you talk about that because I don't know what that is.
Surprise, right?
Mhm.
Yes,
It has, again, we're kind of moving, as you would guess, very quickly as we look toward June 5th, what is it, June 11th, when Illinois enters into the phase 2, right? Phase
five.
5. I'm totally lost my mind where I'm at. It's getting to be phase 5. So one of the things started to come out and we started to look at is requiring vaccinations. The Equal Employment Opportunity Commission came out with a ruling on June, I want to say the last week in May, that indicated, 1, you could ask employees regarding their vaccination status, and 2, you could mandate vaccinations even if it was under emergency use authorization, and that employers had the right to set policy. So in talking again with the leadership team about this and bringing people back into the work environment, was to take a look at, are we going to, mandate vaccination? And if you're not vaccinated, then you must wear a face covering, because face coverings can now be removed in the indoor environment for fully vaccinated individuals. So, and it kind of mirrors or echoes our flu vaccination policy as well. So we are required here to get the annual flu vaccination. If you choose not to, which is your choice, you are then required to mask. And again, it's when our flu, we go above our baseline of influenza-like activity. So this kind of was taken together and mirrored with that. So the idea being that for either what I'm going to call employees, our leadership, our Board of Health, because we're going to be bringing you back into our building for this meeting. And then interns, students, volunteers, contractors. And we have a kind of a grouping here that come in as well, that we would, again, essentially mandate vaccination or face covering, one or the other. Now, the fourth floor is the exception in clinical services. Unless that changes, they would be required to wear a face covering. And even if I go up there to manage vaccine, I would wear a face covering up into that area. So many of our staff, that have to go up there would probably be in both of those. And the other part is that it kind of spells out that we would be required to provide people with face coverings for that part. So that was kind of the discussions about one, individuals that are not vaccinated. We have to make sure that they are maintaining social distancing as well as wearing the face covering. So they have to be 6 feet apart. Again, kind of wearing the face covering when they're in the building. And again, the only requirement that we have is you have to present documentation. We don't need to know all your medical history. It's like we do for flu vaccine or CPR training or any of that. And it would just be yes or no that they received it. If they had not, then they would be required to mask, and the supervisor would be the one that would be the one responsible to inform them of that policy and where they might choose to have to change up their desk location if you're looking at some of the cubicles where they might be in closer proximity, in things like the WIC clinic, and where they would definitely have to be up behind the plexiglass as well. So having to put this in place is return individuals back into the workplace. So the other part, I think that you, again, if you look at the individuals, so the center directors, we have to ensure that individuals working adhere to policies and procedures, and that document individuals who receive their documented vaccination. So each center would be required to, like they do for flu season, is to gather that information and then identify the staff that is not vaccinated and give them the instruction about it. Flu, they have to watch a videotape. Here they would have to mask and maintain social distancing. And then again, everybody should be practicing, hand washing, stay home if they're sick, regardless of whether they're vaccinated or not vaccinated. Wear face coverings in the designated clinical areas. So everyone, regardless of vaccination status, if I go up into work in the WIC clinic, or I'm helping on one of our integrated clinic services, or I'm going up in there to, do vaccine management, a face covering is required. And then if unvaccinated, it's similar to our policy with flu, you have to wear it upon getting out of your car in any of our parking spaces, you enter the building. And the other thing is that they would have to quarantine if they're exposed to a case of COVID-19, whereas a vaccinated individual does not have to quarantine. So again, it's starting to mirror some of the federal policies as it relates to that, but it was a big change in what we thought was going to come out with the Equal Opportunity Employment Commission that identified that asking individuals regarding their vaccination status and requiring them to wear face covering was not a violation of their rights under the Equal Employment Opportunity Law.
I have a question. Under procedures, if unvaccinated, and then it goes into what you have to do, what do you anticipate that requirement being for how long? Forever?
It's hard to say, Ron. At this point, I mean, we review these policies. If, let's say, we change and there's no risk, then it could be looked at. But the flu policy does not have an end either. So until, again, we're going to be taking a look at, I'm going to guess. Now I say guess, I mean, we anticipate that probably in the next 12 calendar months, there'll be a booster dose required. And so we'll have to relook at that. But I would say that this is up for review on an annual basis. Well, we have it for a 2-year. Next review is 5/10/2023. And it could be rescinded again if things or conditions changed, then we'd rescind it. Or if it needs to be modified, like they say, it's now 3 feet, not 6 feet, or 2 feet, not 6 feet. Or they don't have to quarantine. We would modify that accordingly based on the guidelines.
The other thing is, remind me, on the flu policy, that doesn't cover the Board of Health?
I'm going to take a look at it. I believe it's probably not written quite the same way, so it may have been implied.
Well, I think it didn't. Otherwise, I wouldn't be here. So all those years I didn't have flu shots, I was violating the policy if it does say that.
And that was in place long before I arrived. Can any of the Board of Health give a little more?
I thought it wasn't covering the Board of Health because we didn't see the public.
I don't
think I've
remember.
ever heard it. I don't
Yeah,
remember
I
ever
don't
coming.
remember we ever discussed it one
No.
way or the other.
I don't think so.
Yeah, we never even confronted that issue. And really, we should have probably.
Hindsight's so much better.
Well,
Yeah.
if we reconsider it and go in one direction, I'm gonna have a decision to make.
Well, I wonder with like with the flu, I don't know. We may want, just rather than exempting people or not exempting people as employees, maybe it would be during regular business hours or during hours when there's service to the public. I don't know.
Yeah, I thought it was because the employees were covered because they have contact with the public and the health board didn't.
Well, I think though that we're really starting to look though, Ron, and this is an interesting discussion. I'm going to bring this up is that bringing you for an in-person meeting then.
Right.
Yeah. So here is the influenza and other vaccination policies. It's a little, again, can everyone see this? They apply to employees, providers, students, trainees, volunteers, and contractual workers. So they did not explicitly state the Board of Health.
Would we be considered a volunteer?
I'm guessing that's not. I'm guessing that's not because of where it's put in that definition.
Well, I mean, we have a pretty extensive policy on that. Vaccine, I think the other part with influenza vaccine is less effective, right? We know it has not been at the effective rate of COVID vaccine. We certainly can review that as well.
Yes, let me see that first part again. This policy applies to employees, providers, students, trainees, volunteers, and contractual workers.
That does sound like us.
I think that was traditionally interpreted as not covering the Board of Health, and I think I remember it somebody saying that in an official capacity, probably before you, Sandra. Because I have never been vaccinated for the flu, and I have never been challenged on it, nor required to wear a mask. So I think I'm grandfathered in.
Well, we're not going back if that's the case. We're not going back. And but I think we probably are going to have to take a look at that. And it's not that we don't want people that are unvaccinated not to participate. It's that they have to wear a face covering during participation. And that I think the other thing is the board, we haven't really had that conversation while we're coming back into in-person, right? That individual needs to be 6 feet apart from everybody who's unvaccinated. If you're a board member who's unvaccinated, you're going to be seated further apart from the other members. And we're going to have to know that information, not because we really want to get into your personal business, but so that we can appropriately apply the mitigation. It's not an easy, I don't think it's an easy discussion, but it's a discussion everybody is starting to have. I just came off a school call that was in the midst about the return to in-person learning in the fall and what that looks like about mandating vaccination. So yeah, sorry about that.
And would we assume then that we also would need to show the documentation?
Yes.
Okay. Well, and Ron, one thing on the flu one is it's during flu season.
Right.
Right. And also the policy, if you can hold it for a second there, all employees or providers, volunteers, contracted workers, students will be offered the influenza vaccine annually. Employees, providers, volunteers, and contracted workers will be required to sign a consent or declination. I have never been asked to sign a consent or a declination. The vaccination information sheet will be provided at the time of acceptance or declination.
We do a consent.
What?
Yeah, I mean, I
We do a
think, Ron, you're
consent.
right. We have not, how do I put it this way? I don't think that it has been enforced, which is probably a good thing now to bring this all to light, that that would have been my role to enforce it. As the policy as it stood, if we all understood that the Board of Health as volunteers would be required, because you are with staff within the health department and could potentially expose them. Because it's not just patient care. And again, it's during flu season. So typically we start the masking when it starts above what we call the influenza-like illness, the surveillance line. We often talk about that. And then we say we start masking. And that's a county-wide policy as well at all of our healthcare systems. So we start masking and then it stays in place until the flu season, we drop below baseline.
I'd like LAFA to tell me if the state definition of volunteer would cover an appointed person to a county board.
I will have her look at that. She did review this policy, just so you're aware, she did review it already. So that part has been done, but we recognize that probably the influenza will need to be adjusted as well.
Of course, we get our shots at the board meeting, so you'd have record of us having it.
For those that choose to have it done
Yeah.
at the Board of Health, right? But some people might go to their private providers, we don't.
So
Gee.
Sandra, you don't need any action from us on this because it's actually being approved by the policy committee, correct?
No. It will also go to the policy committee as well.
Okay.
I just wanted to bring it forward so that was an FYI to the personnel committee, that this is a
Right.
policy impacting personnel.
Right, so there's nothing that no action that we need to take.
No, I think, but if you have things that you want the policy committee, several of you are on the policy committee following. If
Right.
you wanted that to be carried forward to them, we're happy to carry that through. And I think I've heard from Ron as well that they're a review of the influenza policy as well.
Do we need a motion to just forward this, or it's already on their agenda?
It's
Yeah, I
already.
don't think we need to do anything.
We don't have to do anything on it then.
That's correct.
Okay. Any other questions on that, or save them for the next committee meeting?
Yep.
Okay, well, we'll move on to the item number 3. I guess Sandra, you probably don't need to be in for this part of it.
I will, happy to step aside.
Okay,
Stop my share here and I'll.
okay.
She doesn't have to be there. She doesn't have to be here for it, so she can just go over and watch YouTube.
That's true. Well, we're
The
not
map-
really, I mean, we're just starting. This isn't really anything, I think, that's for executive session, because we're not really dealing with anything other than going over what information we have here. So we've got the official job description, and then the form that we've used for the last, I don't know, Pat, we've probably used this for about 2-3 years now, haven't we? Or 2 or 3 reviews.
We've used this one since Sandra came, I think.
Yeah, I think we changed it,
because-
and
yeah.
then that's what we've used.
Right. I think because during that time when we were doing our hiring and we were reviewing some of the personnel things, we decided we needed to tie the evaluation more closely to the job description.
Yeah, because this was revised in 2016.
Mhm.
Are there any comments on the different categories? Or would you like to continue with this format?
Well, those categories they are the categories in the job description.
Right.
Okay. That was our
So-
choice at the moment. Now we could
Yeah.
do it differently. We didn't used to do it that way.
No, I like this form though, because it does follow the job description.
Mhm.
So what is it? This goes out to everybody on the board?
It
That's-
will.
Did. Mhm.
So,
Yeah, it will
Just
go
the
out to
board.
everybody on the board.
okay,
Mhm.
I don't have any problem with it. I like it short.
And then if you remember, what we did was we asked everybody to put in comments to use the job description along with it. And to do their comments that in a way that related to where they thought the strengths were there any weaknesses in terms of the performance expectations in the job
Right.
description. Am
Then
I
we took
I'm remembering?
Yeah, and then we took everything and just kind of consolidated, so we didn't have a lot of repetition for each of the answers.
So we sent these out to everybody on the board and then told them to send the reply to you, Lucy, right?
Yeah, we will. We have not yet. We will send them out.
Okay,
And then for your information, I had them pull a salary review, so we can just see what where we were for each of the years.
Mhm. Mhm.
And I don't think that's anything at this point that we have to, that's the last component when we get to the review.
Right, right.
But that's just for your kind of an FYI.
I do think that it's worth noting that one of the concerns that we have had before and we want to bring forward into discussion again, I think, is always, are we keeping up with the market?
Right. Yeah, and I don't know.
I don't know how to figure that out.
I mean, I can do some searches on some of the various counties that would be of comparable size.
Mhm.
And I tried that the last time. And a lot of them don't have that information online.
everything's secret.
Yeah, and actually I called a couple of them. One of them actually gave me the information when we did it,
Mhm.
but it's hard to get there because it's not, so many of the counties just don't put that information in their
Yeah.
budgets.
And I think, try to look at counties in our sort of northern.
Right, in kind of in our region type.
Yeah.
And obviously some of them are much smaller than us.
Yeah.
So if they were underpaid, they'd probably tell you what they were making. If they're overpaid, they probably wouldn't tell you.
Yeah.
We knew that we got into difficulty with that before, that we didn't keep an eye on that, and then we were behind the 8 ball. And when
A lot of areas.
Yeah, and yes, even worse with some of our leadership people. And then when it came time to hire a new director, we realized yet again that we were behind.
Yeah, and really, when you look at the salary history, the rate hasn't gone up all that much since 2016.
Mhm.
I'm surprised there was only one increase based on performance.
Mhm. I think that may have been the last year that we did performance increases for anybody.
Yeah, that was 2019. Because the other ones were the COLA and then longevity.
Right.
Yes.
What the problem is that as you're going along, it's hard for the director to get a 10% raise and everybody else gets a 1% raise or anything like that, anything out of the ordinary. And that's how you get behind. But
Yeah.
you also have
Right.
a situation of not trying to destroy morale, et cetera.
Right. And we kept having this situation of budget issues and
Mhm.
concerns.
Yeah,
And I don't think that we're unique there. I
no,
think we're living in a neighborhood that has a lot of people in it with that.
yeah. Well, I will try to, I'm gonna try to do some Google searches with some of the various counties and see if I can get even, one or two
Mm-hmm.
to give us an idea.
Mhm.
Okay.
So any other thoughts on that? Otherwise, I think we'll try to figure, we probably need to allow a good amount. The problem we ran into last time was that if you allow too much time, then they forget about it. If you don't allow enough time, then they rush through it and
Yep.
they don't give it a lot of thought.
Yep.
So what's the magic number to right in between there?
The magic number I thought was 2 times and then threaten.
Yeah.
That was that was my nag tip
Yeah.
when I was
I
chair.
can't remember the last one, how many weeks we gave them. It wasn't,
I think we tried to do it and wrap it up in a month.
yeah.
Yeah, because
Which
otherwise,
when that was
well.
forgiving, that was also to allow time for us to meet and go through it
right.
and approve it,
So
before
if we said 2 weeks, Lucy, and then they were in, maybe it went out 1 week, and then there was a reminder in 7 days that said,
Yeah.
remember, this
Don't
is
forget.
due by, yep.
So
I
I
think
can,
2 weeks is reasonable.
I wonder, I don't want to have Christina included in the board packet.
You don't want to have her.
I don't know if we
include
should have it included in the board packet,
what? Which?
the form itself.
Oh,
I don't think there's anything.
Oh, there's nothing, no,
that we
it's just,
need to
I
worry
don't know if
about.
it'll get lost in it.
Oh, you mean, okay, you mean no, it should be sent to them
Yeah,
separate.
we sent it, it's been sent by email before.
Oh,
Yeah,
yeah.
sent
When we
separately.
sent, you're right. You're right.
Yeah,
But-
no, they're not getting their copy to fill out in the board packet because that'll
No.
get tossed.
Mm-mm. No. Plus the
So-
fact that it has to be a Word document when it goes out.
Right,
And in the board packet, everything is a PDF.
yeah, that's true.
But
So,
I would put the form and the job description in the board packet. I would just repeat it in the.
Right,
minute.
yeah.
Yeah.
I'll have, well, Christina's there so she can hear this, but have her include those 2 documents, not the salary history, just the other 2 documents.
Yeah.
In the board packet. And then we need to have her send out the form to the board members by email.
So you want the job description and
Well-
the evaluation form?
Right. Should we say, I wonder if we should send them the evaluation form by email too?
The job description and I'd put them together in,
Yeah.
in
You
the
want it
email.
sent by email and paper form?
By paper, well, have it included
No.
in the board packet.
Let's put them in the board packet and then let's repeat it in a separate email where we would put the
The evaluation
forms to
form.
fill out in Word format.
Yeah.
And
When
the job
would you like
description.
it back?
Hmm.
Let's see.
I'm looking at the calendar now,
Me too.
and if you're wanting to do this within the next month for the next board meeting, you could probably go up till, let me just bring up the calendar. Where is it? I just had it.
So the next personnel committee meeting would be on July 14th.
Yeah, so you could do it like the end of the month and have it submitted that end of the month. And you're having it submitted to you, Lucy?
Yes.
Okay, I'll note that in the email to everyone.
So you're gonna send it out on the 30th?
No, I can send it out tomorrow and then have them due to you by the 30th. Is that
Okay.
okay?
Okay.
Okay.
Do we want it sent out that soon?
I
Or
don't
do
know.
you want to talk about this at the board meeting first?
I think you have to let the board have a chance to
Yeah,
at least
All
comment
right.
on it.
So I'll send it the day after.
okay, so,
Okay,
That's what I'm thinking.
so you'll send it out on the 16th.
that's fine.
Mhm.
And then
And
we'll
then
have the
at the
due
end-
date on it be the 30th.
Yes.
That's 2 weeks.
That's 2 weeks. Okay. If they do an in-person meeting next week, I won't be there, Christina. So
I
Bob, you're,
don't know yet. If it is in person, I don't know. We could,
okay,
I'll ask.
okay. Otherwise, I'll be here if it's on Zoom.
Okay.
Okay, let's see. I don't see any other comments on that. Okay, I don't see any reason for an executive session. There's no other additions.
I move we adjourn.
Sounds good to me. Is there a second?
Second.
Okay.
Aye.
Bye. See some people in the
Bye.
next meeting.
Thank you. Oh, shoot. Come on. Where is it? Okay. Okay. Testing. Okay. Testing. Testing.
All right.
and running. Rod's already up on policy. And, yeah, I'll leave my computer. Sorry, Doc, I can't hear you. What'd you say?
Lucy, you changed places. I can't hear you.
Yes, I changed places because I was getting too much light from me in the background.
Oh, yeah.
So now I'm in the kitchen.
Made it real dark where you were.
I know, that's a bad spot for this. So I'm in the kitchen now.
It is cooler out there.
I was gonna say, should I continue? Are they already on the policy? All right, I gotta get in.
You got a few minutes.
Well, it's now 88 degrees in Presque Isle with 43% humidity, but no rain.
I knew somebody from a previous church who moved up the press aisle.
Really?
Yeah, he moved up there years and years and years ago. Fred and Linda Witter.
There's a lot of Rockford people up in this area.
These were from Chicago.
Oh,
And yeah, they were in a remote spot, but I imagine everything up there is remote.
yeah, it's funny, we always refer to it as we're in the woods, but when I was in Sweden, they always refer to it as the forest.
Uh-huh.
Which I guess technically this is a forest, yeah.
Yeah.
Mosquitoes are healthy this year too.
Ooh. See, we can get Lafa to smile.
That's what my picture is for.
I know, that's a good picture. But it must have been one of those few moments where we get you to smile. But now you're smiling. That's cool. Is it okay where you're at in your office? Because the health department likes it warm.
Oh no, it's nice over here.
Okay, because they have air conditioning problems right now.
Oh no.
Yeah, so Christina's over there in her bathing suit with throwing water on herself and trying to stay cool, and fans blowing, lights are off. Oh my goodness. Work in the dark.
You should not be working under those conditions.
She just laughs. Hey, the gang's all here
Again,
again.
Yeah.
Except Angie.
Yeah, see, Angie's not here.
Christina, is Angie coming, do you know, or? Yeah, okay. Lafa, we had a question at the last meeting, and you'll probably be asked it by Sandra. In the flu policy, it doesn't mention the Board of Health members, but one of the terms used for coverage is volunteers. And I'm wondering if volunteers covers appointed members of county boards, or is that talking about people that come in to help out in the department? Like, volunteers for passing out pamphlets or whatever.
I have not looked at the flu policy, so
Yeah,
I don't know.
so whenever you get a chance to see how that stacks up.
Okay,
Thank you.
you're welcome.
We got a few months before flu season, don't we?
Yeah, then I have to make a decision if we change the policy.
Or you could wear a mask.
I'm not doing that. I've worn a mask enough in the last year and a half. I'm
I
not
know.
wearing it to meetings if I don't have to.
No, I just keep one in my purse in case. You never know when you go into a store. If usually there's a sign out front that says if you're fully vaccinated, you don't need to wear a mask.
Well, they haven't changed anything. And I went to the dentist yesterday and half the people coming in didn't wear masks. And that's a medical facility. And you're supposed to wear a mask going in. And I was only there for an hour and 15 minutes and I saw 4 patients without masks. So,
wow.
They're not going to say anything.
No.
So I think people think it's already changed.
Well, I think,
Oh, your sound's off.
She didn't.
Christina.
I read her lips. She said she didn't do it.
I didn't do it. Christina did it. No. Yep, you're back.
I did try to unmute and it didn't work. So
Yeah.
that was my issue.
What were you going to say?
What I was going to say is, I think that people have been, in my dentist's office, they would confront you.
Well, you got a tougher dentist.
Well, the policy for any healthcare setting
Yeah.
is, I went for a pedicure and they make me wear it. So
Oh yeah, Karen goes to a salon and for all the stuff there, she has to wear it.
you
Yeah.
have to wear them. So, I'm used to it.
Right.
It actually felt kind of weird the first time I went into a store without it.
Yes. It's like
been
having
done that.
forgotten your clothes.
Yes.
I haven't done that yet. I don't know. I'm not up to that yet. Well, we got everybody here. I think Angie's here, right, Angie?
She's here.
I just don't hear. There she is. All right, so we have a quorum and it's 4:31. We'll start the policy committee for June 9th. I need approval of the agenda.
So moved.
I'll take that other one as a second. All those in favor?
Aye.
Opposed? Okay. Hey, we have this new thing that we only heard about an hour ago. COVID-19 mitigation for individuals working for WCHD. Do we need to explain this again?
Well, Angie wasn't at the other meeting.
Yes, to Angie.
Yeah.
I read it. Sounds good.
Oh, maybe we don't have to explain it to Angie. Sandra, anything you want to say? You got to turn your mic on.
Do we need to change? We need to let her know our discussion?
Yeah, I think it would be important for Angie to hear the discussion that we had. It was presented earlier, Angie, at the Personnel Committee, not because just as an advisory, because the Policy Committee was the one to officially advance or forward. And there was quite a bit of discussion related to this. And it, again, the policy was generated out of the Equal Employment Opportunity Commission came out with a ruling on, I want to say May 24th. It was May 28th that indicated that employers could ask vaccination status and could mandate vaccination status and put in additional, procedures or policies that it did not conflict with the equal employment opportunity laws that were in place at the, really from the federal level. So part of the discussion working through the leadership team was as we bring more people back into the in-person environment, and again, as we open up, Friday is the introduction into phase 5 of Restore Illinois, about the conditions and procedures for vaccinated versus unvaccinated staff. And so worked through to develop this policy. It was mirrored in some ways after the influenza. Obviously, there are some differences about this. This is a 2-dose vaccine, and went through the procedure about it. Basically, if you're not vaccinated, then you will have to be required to social distance and wear face coverings, which is really part of the general guidance that's been put out by the Centers for Disease Control and Prevention. I think what it changes in the work environment, it's not just an honor system, right? So when I walk into Menards or any other location, nobody's asking me my status. If I'm not vaccinated, I'm supposed to do the right thing and wear a face covering, right? And maintain social distancing. And I just came off, between board meetings, I was also on the school policy committee at the state level about looking forward as we move forward on this. And again, looking at whether or not they'll mandate it as part of school code. The challenge they have is the ages yet are not there. So this would require any individual to identify that they've been vaccinated or not. Their supervisor would be responsible. And if they're not, they would wear a face covering in the environments. Now, some things would never change. If you are employed on the 4th floor, if your primary function and role and responsibility is clinic, you're wearing a face covering. And any of us who would go up into that environment, because that's a healthcare setting in the traditional sense. So for instance, environmental health, if they're fully vaccinated, when they're going out to do inspections and field work, would not be required to wear a face covering. If they're unvaccinated, they're required to, and in addition to maintaining social distancing. So you can see that we're all still required to, disclose our status. We still are supposed to hand wash. I think it's a good thing. Stay home and isolate if you develop symptoms, regardless of vaccination status. And wear face masks in the health department in the designated clinical areas. And right now that is the 4th floor and any of our mass vaccination or any of our vaccination sites. If you're unvaccinated, you wear masks indoors and outdoors during WCH, including our parking lots, while conducting business on behalf of the Winnebago County Health Department. They have to remove it while they're eating or drinking. And they can certainly do whatever they like, and they should supposed to be following by the honor system, the recommendations of the Centers for Disease Control and Prevention on their off hours. And the other thing that's very different for them is they do have to quarantine if they're exposed to a case. So versus an vaccinated individual, I apologize. So that was the kind of the discussion and gist. Ron pointed out that probably had never been asked about flu. And so looking at that policy as well, probably is a companion piece.
As being a lawyer, I think I just shot myself in the foot an hour ago. So, but I can't let that slide. I have to deal with this stuff logically, and it didn't follow logically. And the policy is vague, and I know it was always applied vaguely. I was never asked to get a flu shot. We did not ask for declinations or acceptances or paperwork or anything, and it doesn't say Board of Health. So I already mentioned it to LAFA, and she could look at volunteer and what that means, and as far as the state is concerned, in any court cases. I mean, I don't have access to any of that good stuff. So other than Google. And I don't think we can cite Google all the time as a legal resource. So questions, comments about the policy? Suggestions? I think we should exclude all.
Ron,
board
I
members.
with those, for the people who cannot receive that shot because of health conditions,
Right.
How do they handle this?
Wear a mask.
Mm-hmm.
That would be their only thing that they can do. Now, some of them have asthma so bad they can't even wear a mask. And I really feel sorry for people who I have cousins and other friends who are told that or have been told by their doctors, don't you dare get that shot because it would, it's not, you would just have a horrible time because of all your allergies and everything. So I worry about them, especially when they get in a crowd and people start teasing about, why are you wearing a mask and this type of thing. I think we also need respect for those who do wear a mask and not rag on them of why are you still doing that? You don't have to do that. And so I don't know. I just feel bad for them.
I had the same situation in my family with a son and a granddaughter, and they've been told by two different doctors to not get the vaccine because it will just worsen their condition.
Yeah.
And that there'd be nothing that the doctors could do for them. So I had that same situation, and they're going to be ostracized, or they're going to be, it's like wearing the Star of David, in World War II. I mean, it's not going to be pretty.
Well, I think that first of all, one is that there will be other conditions, and there's going to be campaigns coming out on another level about masking, right? That we're not going to mask shame because there are individuals who've been vaccinated that will continue to wear masks. Think we just told you the healthcare workers, right? So when you come into our building and you go up as a clinical patient on the 4th floor, you'll be wearing a face covering in that scenario. You've got individuals whose immune systems, we're vaccinated, may have other conditions. We don't know how robust their intake or their uptake of the vaccine or how protective it is for them. And they will continue to choose to voluntarily mask beyond that. There are individuals, if you're going into a mixed crowd, there is recommendation that, if you're not sure, it's kind of like when in doubt, you want to be wearing your mask because these vaccines are highly effective, but they're still not 100%, right? So I think that we have to be respectful on both sides of the equation, but in a work environment where we are responsible for the health and safety of our employees, taking the reasonable precautions. And that's part of the school's discussions, right? I mean, that's 6 feet of social distancing. Some schools can't maintain that. If the kids aren't vaccinated, they got to wear a face covering because, otherwise they really are in closer proximity. And, the transmission rates are much higher in that population. So again, it's not intended to ostracize. It's really intended to make sure that employees understand that if you're not vaccinated, you'll wear a mask. And if you're in this building and you're going up to the 4th floor doing clinical, you'll wear a mask regardless of vaccination status. But everyone should stay home, right, if you're sick. And we're still going to have to work through this because I noticed we don't have as many commercials for NyQuil and Theraflu and all that good stuff to power through the day. Really trying to get people to understand that we really want to stop the transmission of any respiratory borne illnesses amongst, as we know, a cold goes around an office 3 or 4 times. And so really trying to help on that protection.
I read recently, and I think it was the Wall Street Journal, that flu during this last flu season was down 99%.
Yep.
99%. Much more effective than the flu shot.
Guess those masks work.
And that's been the debate about, I hate to say it, the debate in the schools is about, there are planned protests for Thursday against health departments. We don't know whether we'll be one of them. About letting kids breathe free, like allowing them to remove their masks under all conditions. And, we're debating this at the state level with all the policymakers about how do we manage not knowing everything, right? This year was hybrid, so we were at 6 feet and masks with no vaccine at the start, right? And we were really able to keep transmission rates low. And it's that layering that we've got. So now we've got vaccines. Which one should we take off first, right? Is it the social distancing if everyone's vaccinated, right? So that, your son or, can't sit, in a classroom with the rest of us who are vaccinated, we spread it to that person, right? Because he's the one that's unprotected, or your grandson. That's the challenge that we're faced with. And protecting the vulnerable. And so we're going to have to really destigmatize that whole concept of I'm wearing a mask potentially for myself and potentially for you, right? And what does that look like as we head into the fall and as we go indoors? So I'm saying enjoy your summer months at least. I think vaccines have been a game changer under this particular illness. At some point, and and I know Peter is putting some slides together. As our vaccination rates have increased, the number of individuals in, especially outbreaks in nursing homes and deaths, has declined significantly. And so we really, the group that was most at risk benefited the most as well. And so now we've got that middle group that, it's the hard group to get flu vaccine, right? They're young, they're healthy, but they can spread it to just about everyone else. So, we'll have to continue to monitor this and take a look. And to Ron's point as well, Afa, he said, is this forever? I said, well, right now, I guess at least we're reviewing it every 2 years, but if the circumstances were to change, either one, they came and said everyone has to mask, or two, masks have no benefit, or social distancing has no benefit, we would then, review those guidelines and adapt them accordingly.
One thing we've learned in a year and a half, things will change. Requirements will change. Science will change. It will all change. So you can say we're following science, and then tomorrow science says that what we told you was wrong. Here's some new stuff. So what we can guarantee is it will change somehow.
That's the guarantee, right?
Yes.
And nothing else we say is guaranteed. And I think that's been the challenge with all of this. I mean, what we learn every time, I mean, remember at the beginning of vaccinations that everyone's going to need a booster in 6 months. Now they're saying it looks pretty good for beyond 6 months, maybe a year at least. And then now they're going to take a look at some more data coming out. And I was just kind of got a little blurb that Pfizer has started the trials on the 6-month to 12-year-olds.
How do you get volunteers for that? How do you get how do you get parents to volunteer their kids for that? That blows my mind.
I think you get very committed individuals who have faith and trust, which not everyone has, right? That the appropriate precautions and steps will be taken.
Yeah. Wow. Any other? Yes.
I have lived long enough that I can remember just taking my kids so they get their shots. I didn't question it. Polio, when the polio shot came out, and if you had children, how many of you took your children to get the first polio? It didn't even come in a shot. It came in a sugar cube to make sure your kids didn't have it. We had more trust and worried about our children not getting things. And do they even vaccinate them anymore for smallpox? We've been through all that. I still have the scar from smallpox vaccinations. So, there's always going to be something new coming up. And it will always be something new coming up. And so the first person I wanted to protect is myself and my children. But other people just think it's the government's trying to kill you. Where all these ideas come from, I have no idea. But the majority of us stay sane and do what we're supposed to do.
Whether we like it or not, there are instances of the government killing you, doing stuff that maybe wasn't the best thing at the time. And there was a polio vaccine before the one that worked that gave all the kids polio, and it was pulled back. So a lot of this is experimental, and unfortunately, if you get caught in the experiment stage, you might not come out that great.
Well, by now we should be past that experimental stage. In fact, COVID has been around for a long time, from what I understand, and they've been working a long time to trying to find a vaccine to take care of this. But then all of a sudden it popped up all over the world and put us on page one. So, we have to be trustworthy someplace.
Maybe our challenge is, can we mutate as fast as the virus?
Yes.
Yeah. All right. Anything else on the policy? I think we need a motion.
You want a motion? I'm happy to make one.
Okay.
I move that we forward this to the Board of Health with a recommendation for approval.
Okay.
Second.
Is there a second? All right.
Second.
Any other discussion on the policy and the motion? Okay. All those in favor?
Aye.
Opposed? All right. We will pass the policy on to the board next week. A question arose, Sandra, before you came on the last meeting. We're not in person next week, are we?
My understanding from Christina, that from all of you, that you were in person next week.
We are in person next week.
Yes, that your
Okay.
committees were going to be remote, and that, but again, and you were going to have your board meetings in person. But is there a challenge with quorum at this point?
I won't be there.
Will you be available
Oh,
by
sure.
Zoom?
Oh, yeah.
Okay.
But that's not a quorum then. I mean, she can't go towards the quorum, right?
Well, the executive order has not been lifted yet,
Okay.
right? Right. A lot of that, they're still allowing, and I believe that they're still actually considering over the long haul, aren't they?
Correct.
Maybe you can give a little more guidance on that on the board, on the Open Meetings Act.
Correct, because the county board is still hybrid as well.
So, I mean, if we can send out a poll, and if you'd prefer to remain remote for really, I'm going to say for a convenience of participation, right? It's not under COVID regulation. We can certainly meet the standards and guidelines, right? Because next week, definitely there's no capacity limit on rooms or that. We can certainly query and poll the board and find out if that would be preferable. Would you prefer that for us to send out?
Yes.
Sure.
We
Okay.
did,
Let me make it, I want to be clear. What is it you want to do?
As the board members, would they prefer to be in person?
Okay.
And the hybrid for us will be a little more challenging when they say hybrid, because they have cameras at the county board meeting, and then you can do both. For us, it will be a little more challenging. It's not to say that we couldn't. I'm not sure what the experience would be yet, because our camera system in 115 is not that great. So we haven't really advanced beyond that. But if you prefer, if the group prefers, the majority prefers remote, we would just conduct the board meeting remotely.
Okay. Yeah, I think that'd be a good idea to ask.
And maybe I've got finance following this. I guess I could ask you right now and get.
Right. I would prefer to do it remote, and that would get Lucy into the meeting and not on a screen somewhere. And it might help with our quorum.
Yeah, because I believe Mr. Powers is not available for the board meeting, correct, Christina? He's out of town.
But he could go on Zoom?
I don't
He'll
think
be back next week,
Okay, he'll be back next week. Okay.
but he'll want to do remote.
Okay. How about the rest of you? Pat, Bob?
I prefer
Yeah, I'm
remote.
good. I'm good either way. But yeah, I think part of the question as we look at summer is many of us have some amount of travel or trip or something.
Right.
I know if we have in person, I will miss July.
Okay.
I will too.
Yeah, it may be a quorum issue, and maybe when we were thinking about it, I'm not sure we were all thinking about that.
Right. I think it'd be better. Well, at least it sounds like most of us here, we do remote better than in person. And it would
Well, I
help with quorum during the summer, like Pat said.
We have not had, think about this, for our, really since going into the pandemic and the remote, we've had a quorum at all times.
Mm-hmm. In the committee meetings too.
Yes, we have.
It does help.
It does help. And, you know, again, they are posted. We've got all the, documents up. I think Todd and I think the other interesting thing is I think for presentations, I like it a little bit better because you can see things a little more clearly on the screens. That's the upside. The downside is, I think the challenge is making sure the public has access to participate and making sure that they are constantly aware that they have the opportunity to participate.
I think they get that opportunity more when it's on YouTube, because we've never got anybody at the meetings unless they had a vested interest in an issue.
Right.
So, I mean, we had open meetings, but nobody wanted to show up there unless they had something on the agenda. This way, it doesn't matter if you have something on the agenda or not. You have a chance to watch what's going on at home. Much more convenient. Well, see what finance says, but looks like this group is okay with staying remote for a while.
yeah.
Yep.
Yep, Angie too. Good.
All right.
Yes. We discussed this at our caucus meeting the other night, and many of us like having our committee meetings on Zoom. We prefer that because then, for me to go down in town and listen to two meetings that I'm not on, I probably wouldn't do it. But at home, I was so happy the other last week that I was able to, for the Committee of Operations and for Finance, that I could sit right here, watch those while they were going on and participate in them. But for me to have to go down, and I would have missed both of those, and it was important that I be there. Even though I'm going to vote on them this coming Thursday, at least now I know what I'm going to be voting on. So, and they're talking about our regular meeting, about us meeting back again, and that's fine by me for our regular meeting. But our committee meetings, it's so much more convenient doing it this way.
Remind me, did we ever vote on this motion?
Yes, you did.
Yes, we did.
All right, good. Because we got so much discussion afterwards, I got lost here. All right, good. Anything else? Look, I guess all that discussion was additions. So we don't need an executive session, I'm assuming.
Nope.
Okay, so we have a motion to adjourn.
Motion to adjourn.
Second.
Second. All in favor?
Aye.
Aye.
All
Wow,
right.
unanimous.
Good seeing all of you.
Yes,
Yes.
and I will have Finance Committee. Angie will be seeing you on the Finance Committee.
Yes, and I have a question to ask of you, Dr. Martell. Do you have someone